Hello, and welcome to the Evidence-Based Practice Reporting Guide training video. My name is Joanne Gonzalez, and I'm the Program Assistant at the CoLab for Community and Behavioral Health Policy and Evidence-Based Practice Institute at the University of Washington. I will be guiding you through this informational video. The Evidence-Based Practice Institute was asked to help guide providers so you can feel confident in reporting evidence-based practices, also known as EBPs. The Evidence-Based Practice Reporting Guide helps Washington State track how often public mental health agencies are using EBPs in their work with children, youth, and families. The state asks for this information every year, and it's an important part of maintaining the quality of services because it allows for a statewide monitoring system to track the use of EBPs, provide feedback on their use, and plan improvements to the quality of care around the state. Additionally, the hope is to align EBPs with higher reimbursement rates in the future. Billing codes were ultimately selected as the method for tracking EBPs in order to avoid additional burden on clinicians and agencies by asking them to report through a separate database. However, we want to provide guidance on proper documentation of EBPs in existing treatment plans and progress notes to ensure reporting is accurate. If you have not had a chance to review the latest 2021 reporting guide, you can download it from the following link and follow along with this video. This video will cover the following topics: defining EBPs, the EBP components model, steps to report the use of an EBP, and case example. First, let's go over how we define evidence-based practices in the reporting guide. EBPs are therapeutic interventions supported by research suggesting that they are effective at improving children's mental health outcomes. At CoLab and EBPI, our definition of EBPs also includes the ability for clinicians to incorporate cultural responsivity, flexibility, client feedback, and clinical judgment into their care. Although EBPs are often promoted as manualized, step-by-step interventions, we approach them differently. Instead, we break down different treatment approaches, like CBT for anxiety or interpersonal therapy for depression, into their core evidence-based components. Our goal is to create flexible, adaptable ways of using evidence-based approaches in behavioral health care while preserving the core elements of effective treatment. Let's dive deeper into what the components model looks like when providing care. To create this model, we worked with content experts to identify the common active ingredients that are empirically shown to be the primary mechanisms for change in a particular treatment approach. For example, CBT for anxiety is defined by the use of exposure and cognitive restructuring. These are the active ingredients that distinguish it from other treatments for anxiety. Each of these ingredients, or elements as we call them, is supported by the evidence base but is meant to be applied flexibly at the clinician's discretion. The reporting guide instructs providers on how to document their use of evidence-based clinical elements as part of a treatment family that is determined by the clinician and the client. We will go over this in more detail later in the video. Individual treatment approaches, or EBPs, that use the same core elements or active ingredients have been grouped together in the guide and are called treatment families. Treatment families are useful for referencing how to report, organize, and structure the clinical elements you are providing in sessions. This can help ensure you are using the clinical elements recommended for that EBP and that you are accurately reporting the interventions you use with a shared reference language. The reporting guide includes the following treatment families. For example, here's the list of approved training entities for CBT for anxiety. As long as you have received training from one of these organizations, thereby demonstrating you know how to effectively deliver the core components, you can report the use of that EBP. If you can't find a training you received listed under its treatment family in the guide, you unfortunately cannot report it as an EBP at this time. Please reach out to us so we can consider it for the next guide. Let's go over the steps you would take as a clinician to report on the use of an EBP with a client. First, you need to make sure that you have the appropriate training in the EBP you are reporting. This means that you have received training from one of the approved training entities listed under the EBP's treatment family. As previously mentioned, training entities are organizations that train on specific clinical, therapeutic interventions and treatments, and some train on multiple therapeutic interventions. By showing that you have received training from a vetted organization, we expect that you have the skills to provide that EBP. After receiving training from an approved entity, a clinician is now able to report that EBP when used with clients. There are two things that a clinician needs to consider when determining eligible services for EBP reporting. First, the client needs a diagnosis to match the EBP treatment family. For example, if a client's primary diagnosis is anxiety, your reported treatment should address anxiety. We know it's common for clients to have more than one diagnosis, so you can list multiple EBPs within one treatment plan. Second, eligible services provided need to be longer than 30 minutes of group, individual, or family modality in order to count as a reportable EBP. You do not need to report modalities such as medication management, intakes, case management, or other services that do not involve the active components of psychotherapy treatment. Once you've confirmed the EBP training you're reporting, look in the reporting guide under the corresponding treatment family to find the common elements language for accurate documentation. After determining that you will use a particular EBP treatment family approach with your client, document this intent in your treatment plan or individualized service plan by naming the essential elements you intend to use during treatment. For example, the essential elements in the treatment family CBT for anxiety include exposure and cognitive restructuring. At least one of these should be part of the initial treatment plan and documented in that form. Lastly, for each individual session that you are reporting as an EBP, you will document your use of an allowable element in the progress note. The allowable elements for each treatment type are listed in the core elements section of the guide and are defined as the common clinical elements that support the efficacy of treatment in that treatment family. Many treatment families have the same allowable elements. Examples include motivational interviewing, psychoeducation, and measurement-based care. To provide a specific example, if you are treating a child for anxiety with CBT, you could likely spend a session on psychoeducation, which refers to educating a parent about child anxiety. You would then count the session under CBT for anxiety as long as the treatment plan, as described above, also includes your intent to use exposure and/or cognitive restructuring at some point in treatment. As a clinician, you may or may not need to know about the specific billing codes tied to the EBP you use and document with clients. This will depend on your organization and how your electronic health record system is set up. Given this, we will share a brief overview of how EBP reporting and billing codes work. Each EBP training entity has a unique code tied to it. These codes, which are all listed in the guide, communicate two things. One, they show that you received training from a vetted training entity, and two, that you provided treatment in line with the corresponding treatment family under which the training entity is listed. This connects the EBP provided to billing and allows us to track how often a specific EBP is used. Someone at each agency should be responsible for standard billing procedures and connecting what you document in session to the reporting of EBP codes. This then connects to funding sources such as the Healthcare Authority and then gets reported and tracked to the state and the EBPI. Please reference the reporting guide for more detailed information about billing codes and reach out to us if there is uncertainty about accuracy of reporting with your EHR. For a full alphabetized list of all eligible EBP trainers and their EBP codes, please see the table at the end of the reporting guide. Let's walk through how a provider might use the reporting guide with a case example. Let's say I have just completed an individual therapy session with a client who has a primary diagnosis of anxiety and I want to report the EBP CBT for anxiety. Step 1. Have I received training from one of the approved trainers listed under CBT for anxiety? Yes, I have already received training from Harborview CBT Plus Collaborative. I see it listed here as an approved trainer for CBT for anxiety treatment family. Step 2. I determined that CBT for anxiety would be a good fit for this client's symptoms and diagnosis. Step 3. The Harborview CBT Plus Collaborative training is listed under the treatment family CBT for anxiety, meaning I can credibly report administering CBT for anxiety as an EBP. I will go to the section of the guide to identify and report the essential and allowable elements when writing my treatment plan and progress notes. Step 4. Treatment plan or individualized service plan. Is at least one of the essential clinical elements listed in the treatment plan? For this client, I included exposure and cognitive restructuring in the treatment plan, therefore meeting the requirement of using at least one essential element for CBT for anxiety. Step 5. Session progress notes. Is at least one of the allowable clinical elements listed in the progress note for the session? For this client, I provided psychoeducation about anxiety symptoms to the parent, which is one of the many allowable clinical elements for CBT for anxiety listed in the reporting guide. So, this meets the reporting guidelines and I can count the session under CBT for anxiety. This concludes the steps for reporting evidence-based practices used with children in Washington State. The steps are intended to place minimal reporting burden on the provider. However, continuing to rely on self-report is only possible when there is consistency in reporting among sites. We hope this video helps answer questions that you and your organization may have about what an EBP is and how to report it in your documentation. Thank you for taking the time to learn about the standards for reporting. Please direct any additional questions to the CoLab for Community and Behavioral Health Policy and the Evidence-Based Practice Institute at the University of Washington.